How are you, Elaine? Is everyone set up? Very good. Well, we do have an important health announcement today with the Health Minister and the Chief Health Officer, another milestone in our pathway out of COVID-19. I know some of you will have questions about the Coljak review. I'm happy to address those after we've taken questions on the health announcement, but we are able to announce today that the quarantine requirement on close contacts, that is household contacts, can now be eased, commencing on Friday the 29th of April, so that's in 1 week's time. This is one of the last restrictions impacting on our community and our economy. We know it's having an effect on businesses, on schools, on indeed the health system. It'll allow us to get more people back to work. There will still be some requirements on those close contacts, and the Health Minister and the CHO will outline what they are, but this is great news. It's another step out of this pandemic. It follows and brings us into line with New South Wales and Victoria. We'll also be able to ease the restrictions on unvaccinated travellers, and again the Minister and the CHO will outline those, but it keeps us in line with those other states, and we can only do this safely because of our fantastic vaccination rate. And so well done to all of those Queenslanders and all of our health staff who've achieved that vaccination rate.
Thank you, Acting Premier, and today is another exciting day in our journey towards living with COVID and a new normal. We know that quarantine and isolation have really protected the community for the last 2 years. It's been a very key measure that we have initiated to avoid a Delta outbreak and also to slow the spread with Omicron. But now is the time to take that next step. And looking at our numbers today, we're very pleased to see that for the first time in a week, we are below 500 public hospital beds as far as COVID inpatients, and we have just hit 92% double dose for our 16-year-olds and above. So this is another important milestone, and I'm very confident, based on where we're seeing our first doses and now hitting the 92% milestone for second doses, that we can get to at least 95% of our population being vaccinated. So what we are announcing, it'll actually take effect from 6 p.m. next Thursday evening, that the quarantine requirement for close contacts will lift. What will be required though for close contacts is that they will be required to wear masks indoors and where they cannot socially distance outdoors for that 7-day period. They will also be required to advise their employer that they are a close contact before returning to work. They will be required to take a test every 2 days, including the first day that they become a close contact, and ensure they have a negative result before going out into the community. Of course, we still encourage people who can work from home, who are close contacts, to do so over those 7 days. And I'm aware that some people will still be required to stay at home because they're looking after particularly a child who is a positive patient. And I'm aware that the Commonwealth provisions as far as payments still apply to parents who are required to stay home to look after a child that is under the age of 16 who has tested positive. We are moving from a situation where these measures are controlled by public health directives, and now leaving it to individuals and employers to look at this from a workplace health and safety measure. In vulnerable settings, we will make sure that we are still taking those additional protections around PPE and frequency of testing for our health workforce. And of course, it will be at the discretion of the local hospitals, depending on the role that those close contacts may be performing, as to whether they should be in the workplace or not. But this really is an individual's choice now. This will bring us in line with New South Wales and Victoria, and we will also be lifting the requirement for unvaccinated international arrivals to quarantine. This will come into effect at the same time, 6 p.m. next Thursday, which is 2 days before New South Wales and Victoria. But it is important that every state along the east coast of Australia will have the same rules for unvaccinated international arrivals, making it very easy for international arrivals to fly into any one of these states, including Queensland, and to move around and have consistency in relation to those rules. It is important, however, people understand that the lifting of these quarantine requirements are for people who are asymptomatic and are testing negative. If you have symptoms, you must stay home, and I know the Chief Health Officer is going to touch on this shortly as well. So I do want to thank all Queenslanders for the tremendous work that they have done in managing the virus and following the restrictions so far. We ask people to comply with these requirements because we do need to inform everyone that in lifting this quarantine requirement for close contacts, we do expect to see an increase in positive cases. It will mean by people going out into the community, back into their workplace, while they are close contact, there is greater risk that they will become positive and spread that to other people. So it is more important than ever that people, whether they are in a household with a positive case or not, be watching for symptoms and getting themselves tested and staying home. And we do strongly encourage, of course, people to continue to register their positive results from their rapid antigen tests so that we can keep monitoring what is happening in the community. But again, a big shout out to our health workers who have done a tremendous job. We are still above the low threshold mark after our first wave of Omicron, which came down to 214 cases in our public hospitals at our lowest point. And that is why we are waiting another week before we lift these measures to give our hospitals time to see those numbers of inpatients come down a bit before we get into the winter flu season. I'll now hand over to the Chief Health Officer.
Thank you very much, Minister. So with very high levels of vaccination and the BA2 wave now past its peak, it will be time to ease close contact and quarantine restrictions in Queensland from next Thursday, the 28th of April at 6 p.m. The BA2 wave has been much flatter than the BA1 wave that we saw in January, February, but the numbers on a 7-day floating average have been declining across all age groups, with the possible exception of the 60-plus age group, where it's been flat for the last few days. In terms of hospitalisations, these also have been somewhat flat, hovering around 500 to 550 in public hospitals for a while, but they now appear to be falling. There are now 476 patients with COVID-19 in Queensland public hospitals, which is down from 526 yesterday to about 10%. I am told by doctors on the ground in our hospitals that a lot of the people that are being admitted with COVID pneumonia have not received their boosters. That still seems to be an ongoing problem, that particularly in the older age groups, anyone, and when I say older, I mean anyone over the age of 40, 50, who has not received their booster, they still are at significant risk of COVID pneumonia. So that would either be the third dose or the fourth dose if you're over the age of 65 and it's been 4 months since your third dose. So from next Thursday, the 28th of April at 6 p.m, close household contacts of people with COVID-19 will no longer be required to quarantine, provided they are well. They will need to wear a mask outside the home for 7 days and avoid high-risk settings such as hospitals and nursing homes. And they're encouraged to work from home if possible, if that's possible for them to do. This is close contacts of people with confirmed COVID-19. Now, if they are going to work, they need to notify their employer or educational institution that they are a household contact of someone with COVID-19. The single most important thing to note is that if you are a household contact of a person with COVID-19 and you develop any symptoms suggestive of COVID-19, you must assume you have COVID-19. You must isolate immediately at home, get tested, and remain isolated at least until your symptoms have resolved, or 7 days if you test positive. And if that's the single most important measure. So if you're a close contact of somebody in the home environment with COVID-19 and you develop symptoms suggestive of COVID-19, you need to assume you've got COVID-19 and quarantine at home. Sounds obvious. If you test negative on a rat, I think we all are well aware that these are not reliable, and I would still continue to isolate at least until your symptoms have resolved, or alternatively get a PCR. If you test negative on a PCR, then probably that's a reasonable evidence, assuming your symptoms are not severe. If you have really obvious symptoms suggestive of COVID-19, you've got to exercise some discretion. I would still quarantine. I would still stay at home until your symptoms have resolved. As a general principle with any respiratory virus, if you have symptoms, you should be staying at home until your symptoms have resolved. That applies to influenza or any other similar respiratory virus. Now, as an additional secondary measure, where practicable, if you are a household contact of someone with COVID-19 and you have no symptoms, and you need to leave your home, say to go to work or to go into other public environments, you should return a negative rat test every second day, starting from the day of becoming a close contact. So that's on days 0, 2, 4 and 6. So this is a secondary measure, and I'm not suggesting that you force little children to have rat tests every second day if that's causing stress. It's a secondary measure. The primary measure we're taking, if you're symptomatic and are a close contact, you should stay at home. But a second daily rat test is certainly a useful measure, and it can pick up cases before symptoms develop. So it is worthwhile. Okay. So moving on then, in addition, quarantine for international arrivals, whether vaccinated or not, will no longer be required from Thursday the 28th of April at 6 p.m. As we've heard, it's been a key measure in controlling the pandemic in Queensland. As I said, for most of 2020 and 21, most of our cases have been overseas arrivals. However, now that the virus is widespread in the Queensland community, the risk posed by international arrivals continues to decrease. And that brings us into line with most other jurisdictions, or all other jurisdictions in Australia. Now, international arrivals, whether vaccinated or unvaccinated, will be asked to return a negative test within the 24 hours after arrival and to have further testing if they develop symptoms. International arrivals will be restricted from entry to vulnerable facilities such as hospitals and nursing homes for 7 days. And in our current context of widespread transmission of the virus in the community, this is unlikely to have any discernible impact on the transmission of the virus in the Queensland community.
Now that unvaccinated people don't have to quarantine, how much money is going to be spent leasing Wellcamp for the rest of the year?
I don't have the exact lease costs for the rest of the year. We've provided some of that material on the record. Some of it continues to be commercial in confidence. The governance board, who are responsible for determining how our entire quarantine system works, including Wellcamp, will now assess how this change of policy settings affects their mix of accommodation needs. There are currently 87 people at Wellcamp. Most of the recent usage has been for those who test positive, aren't sick enough to require hospital care, but do require appropriate accommodation. So, for example, homeless people or people who test positive before departing the country after their accommodation here is no longer available. So there'll still be some ongoing need there. The governance board can consider what other need there might be and how best to utilise that facility. I can also advise that the Commonwealth Government recently notified us that their facility that they've been building at Pinkenbar will now be available from June. Officials of the Queensland Government will now meet with Commonwealth officials to discuss if and how best to use that new facility that the Morrison Government has built for us and will be available in June.
So you'll continue with Wellcamp?
Wellcamp will continue to operate throughout that initial 12-month lease period. You'll be aware we have an option to extend that lease, but our commitment is to the initial 12 months. And as I say, we have an additional facility that the Commonwealth is building and will be ready in June, and we'll discuss with them how best to use it.
What's the total cost of the lease?
Sorry?
What is the total cost of the lease?
The details of the lease, as I've explained before, are commercial in confidence, but we've outlined some of the costs to ensure that people are aware of that. I'm not aware of the cost of the Pinkenbar facility. It's still under construction.
Do you think these changes, though, drastically reduce the need for Wellcamp now, surely?
Well, it clearly changes the need for Wellcamp. It clearly changes the need for the Pinkenbar facility that the Morrison government is building and will be ready for us in June.
The Pinkenbar facility though
Pinkenbar,
is
or?
permanent. Though, and the Pinkenbar facility is permanent. We only have Wellcamp for 12 months.
Well, the facility at Wellcamp will continue in various uses beyond that 12 months. Our lease over it extends for that 12-month period. Holding these facilities come at a cost. We'll discuss with the Commonwealth how to meet the costs of the Pinkenbar facility.
Do you think it's a white elephant?
Pinkenbar?
Wellcamp.
You can make that assessment.
Acting Premier, on the integrity culture.
Okay, are we finished with health questions?
Can I just ask, sorry. The Health Minister just wanted to check this wouldn't add more pressure onto the health system. Are you confident the health system will be able to cope with the easing of these restrictions, given it will lead to more cases and deaths?
I think it's likely that COVID-19 will continue to be transmitted in the community for some considerable time, months or even years. So it will place an additional burden on our healthcare system for many months, probably. That's over and above what has previously been projected. So yeah, it will put a stress on the hospitals, there's no doubt.
And even if we're going into winter, you're confident it can cope? Just last month we saw the fourth highest number of calls to the emergency department.
We expect that there probably at least one ward in every major hospital will have to be looking after COVID patients going forward for some time. We can't, stop doing. We can't stop moving forward because of that. This relaxation of restrictions may lead to a slight increase in the number of cases across the country. That is possible, but we do need to move forward.
Thank you.
Thank you. We can let you go if you like.
You don't want to hear this.
Acting Premier, do you still think the government's integrity issues are revived?
Well, I'm not sure if you were there that day, Dominic, but that quote was in direct reference to David Crisafulli saying he'd discovered a thread. And so I indicated that a thread, a vibe, was insufficient for a Royal Commission. What we have done, though, is we've commissioned the Coldrake review, and he's yesterday issued that interim report. This is a review that we've commissioned, and when we receive those recommendations, in a couple of months' time, we will implement those recommendations. We are determined to continue to do better, to continue to serve Queenslanders better, and this review will help us to do that.
Based on Professor Coldrake's observations, though, does the government have an integrity problem?
Well, these are initial observations, he says himself, based on the interviews that he has currently performed. It doesn't yet include findings or recommendations, though it does start to indicate the areas he thinks that we can improve upon, and we welcome that. Certainly, we welcome the opportunity to have these set of fresh eyes, as the Premier indicated the review would be, to look at what we do and determine how we can do it better. And look, I'm not afraid of receiving advice about how we can do these things better. In fact, I'm eager to. I'm eager for us to continue to improve. He puts the challenges that we face in the context of public sectors around Australia and around the world. These are not unique challenges, and we are determined, though, to be at the cutting edge of addressing them. And I think having this full and frank review by an expert like Peter Coldrake is really useful, and I welcome it.
Do you accept that your party's decision to hire Evan Moorhead and Cameron Milner to run your re-election campaign has undermined public confidence in your government?
So there's a range of remarks made about lobbyists in this interim report, and as you're aware, there are also other reviews about how lobbying operates in the state, the Yaburi review. We'll look forward to the findings and recommendations from Coldrake about lobbying. Much of the remarks he made go to the point the Premier has previously made, in that regulated lobbying is only a small proportion of the lobbying that occurs here in Queensland, and so whether our whether our mix of settings are right to properly regulate both currently regulated and currently unregulated lobbying. They're very good questions, and questions that I'm sure the findings and recommendations will be useful.
About his remarks about lobbyists being brought in to run re-election campaigns, do you accept that undermined confidence in your government?
No, I think most lobbyists have connections to one or both sides of politics, not just the Labor side. There are many, many Liberal-aligned lobbyists, and they are working on campaigns right now because in their personal lives they have alignments to a political party, just as anyone is entitled to have. And so, look, I saw those remarks. I look forward to any recommendations or findings that Peter Coldreck has. Obviously, we will implement those.
In the 2 years, though, since Evan Moorhead was brought in to run the re-election campaign, he's become the go-to lobbyist in this state. Coldreck said that there was a perception that lobbyists can get better access to government. How do you respond to that?
Well, the point you make, Lydia, is that that lobbying work has largely occurred since they worked in our campaign. So it's not possible to go back in time and take people out of the campaign. I understand that there will be ongoing scrutiny of that and other matters related to lobbying. Findings and recommendations, I'm sure, will be made, and we'll take those on board.
Do you speak to Evan Moorhead on the phone?
Occasionally, I see Evan. Yeah.
Do you take detailed notes of those conversations?
We very rarely talk about his representation of companies.
And given he is a registered lobbyist, do you take notes of your phone conversations with him?
All of my lobbying interactions with him are recorded and publicly available.
In 2020, you said voters were comfortable with the safeguards in place around lobbying and that no one else had raised issues with you about that. Do you still hold that view?
Well, that was my view in 2020, and I hold that what I said in 2020 was what was the view I had in 2020. Since then, obviously, there's been a lot of discussion, including in this review. And if this review makes recommendations or findings about how we should change either regulated lobbying or unregulated lobbying, we'll take that on board. But you can't expect this review to change what I thought in 2020.
You say you're determined to continue to do better. What do you need to do better at?
Well, this interim report points to some of the areas that Peter Coldreck clearly thinks we can work on. Some of them are fleshed out in detail, others are just flagged as future work, and so we look forward to receiving that report. We've never said we were perfect, ever. This is a government determined to continue to do better, determined to take on advice about how we can do better. We commissioned this report, we will hear the findings and we'll implement them.
This also highlights the politicisation of the public service. Does that concern you, and how do you go about dealing with that when you have ministerial staff acting on a self-imposed whim to protect ministers?
So there's a range of instances reflected upon in this report regarding the role of ministerial staff. And let me say first of all, in my experience, I've certainly been very well served by the public servants who have worked for me, the Directors General who have worked with me. They do a very good job, and they've always provided me, I believe, with frank and fearless advice. I'd like to say to them and reiterate what the Premier said, how they should feel empowered to provide that frank and fearless advice. When it comes to ministerial staff, can I also say that they work very hard and they do an important job that is often difficult, and they make mistakes. And if they've made mistakes, if there's ways we can help them to do their job better, then we want to. There are 230 ministerial staff. Currently 201 of them have completed Code of Conduct training. There is another round of training scheduled in May, which will pick up those newcomers and people who might have missed out on the other opportunities. They might have been on maternity leave, for example. So we'll make sure that they all get that training. We also have a new training course that we've now completed, which focuses very much on the interface between the executive and administrative wings of government, and we will make sure that all of our appropriate staff get that training.
Have you experienced these young staffers who seemingly have a lack of life experience and that are thrown into jobs that seem to be throwing their weight around with not much backing behind that? Have you experienced that in your office? Or?
As I say, I have great respect for the work our ministerial staff do. Some of them are young because it is a difficult job. It's often 24/7. It's hard to do with a family. I was a staffer with a young family, and it's a challenging job to do. And so sometimes it skews to those that are younger, but they're not all young. We have many that are older, some with life experience, many who've come from the press gallery. Some of you might know them.
Is life experience needed though to fulfil those?
We have a range of people with different kinds of life experience. Until recently, I had 2 economists in my office. We have people with a wide range of different experiences, but these are also political positions, and so it shouldn't surprise anyone that many of them are also members of their respective parties. That's not unusual. If you were to look at, for example, the Commonwealth Government, most of their staffers are also members of the LNP.
The observation is though that there's...
Just onto my question before about documenting contact with lobbyists, you say that all of your contacts are published publicly. That doesn't actually include all of the detailed notes that people might make during those meetings. For example, Minister de Brenny met with Denise Spinks a few months ago. He said it was a casual chat, so he didn't take notes. So when you have these meetings with lobbyists, not the fact that it goes onto the register saying I met with the lobbyist, do you actually take detailed notes of every conversation that you have with him?
Well, look, all of my meetings that relate to portfolio business have staff there who's generally it's their role to take notes on those interactions. But I'd emphasise that those kinds of meetings are quite rare.
What about when you speak on the phone, though?
I don't speak on the phone with that particular lobbyist regarding those business.
What about Director Generals leaving ministers in the dark in terms of certain reports or certain details so that they can continue to deny knowledge of things? Is that good enough?
I certainly haven't experienced that. Where Directors General think I need to be aware of an issue, they will always raise that with me, and I've certainly always found them willing to do so. Obviously, they don't brief ministers on everything, and they don't brief ministers on every instance of everything, but I've certainly found in the working relationships that I've had with my Directors General that they have always been very fulsome in providing that advice.
So you just spoke about training before, the new training. Was that, when did that start and what was that about?
So this is a course we've been working on with Griffith University. It's a program directly related to the interface between executive government, that is ministers and their officers, and the public service, the bureaucracy. It's been trialled and has been proven successful, and we will now roll it out to all other appropriate staff. I think that's an appropriate measure given what's in the interim report. Obviously, more detailed responses will come once we've seen the findings of the contract review.
When did that start? Sorry.
Look, I understand the course was completed in recent months and people started going through it in recent months.
The observations with ministerial staff though is that they're sanitising and they're asking for advice to be sanitised and altering recommendations. How can you justify that behaviour? It's not just that they're young.
Well, as I say, I don't think that's a universal experience. There are certainly clearly instances of it documented in this review, and we want to do better than that. And so we will put in place what recommendations are provided to address that. But they are instances, and by and large, we are very, very well served by our public service.
Jared Blay suspects ministers from the Premier down are requesting to be kept in the dark so then they can say that they're not aware of issues. What do you think of that?
Look, Jared Blay makes things up pretty much every day. I'm not going to spend my time responding to things Jared Blay thinks
It
happen.
wasn't in the report, though. It was in the report as well.
What Jared Blay said?
That staff members weren't passing on reports if their ministers were not to answer questions on them.
So what did it say?
It said,
Where in the report?
I'm not sure exactly what page I have the
Okay.
report.
It talks about, well, there was an instance of the DG not passing to the minister.
Address it.
Who is it? Yeah.
So there was an instance of it comes back to the Director General not passing a report on to the minister, where the minister can then forcibly deny knowledge of a certain matter. It goes back to the heart of that issue.
It's quite common for Directors General, even officers at lower levels, to have to make judgment calls about what can be dealt with at their level and what needs to be briefed up to more senior levels, including to the Minister. I've certainly always had great confidence in my Directors General and senior officers, DDGs and others, that they know when they should brief me, and they have always, in my experience, been very fulsome in those briefings. Now, I'm not denying that the report says there are instances of this occurring. Clearly it does. And that's why we want to see these recommendations, see these findings, have them introduced, because we want to be a better government. And this review will assist us to do that. The only leader of a government I know of that thinks their government is perfect and doesn't make mistakes is the current Commonwealth government, and I don't think they're doing a very good job, and so we want to be better than that.
Will you be committed to enforcing all of the recommendations? Can you do that?
Well, as you're aware, that's generally what we do. Pretty much every report like this we've commissioned, we've either accepted or accepted in principle all of them. You know, I can't commit to that, I haven't seen them yet, but generally that is our approach, and certainly we are eager to see these findings, eager to be able to implement them.
When is the government, I guess, going to deal with the issues in the Integrity Commissioner's office, particularly around staffing? I mean, there's been several reviews now that have said she doesn't have enough staff, so when will that action be taken?
Look, I'm not across the kind of operational details of that. What I do expect is that just having read what Peter said in his interim report, that he will have recommendations about the integrity ecosystem. I suspect that will go to the overlap, the mishmash between different integrity organisations. So it will be appropriate to look at that before, I think, committing to what the ongoing mix of those integrity organisations will be. I think that's going to be a really useful insight.
Given what Professor Palaszczuk said about lobbyists working in election campaigns undermining public confidence in government, do you think lobbyists and people working for lobbying firms should be banned from working on election campaigns?
Well, again, we'll wait and see what those recommendations are, but the point you've made, Lydia, is that this happened the other way round. They worked on an election campaign and have been largely lobbying since then. It's not possible to go back in time and address those things.
Firm in August, the election was in October, so it actually was performing as well.
The report, I'm sure, will make recommendations about whether changes need to be made to both regulated lobbying and unregulated lobbying. I look forward to seeing those recommendations. No doubt it will go to the issues that you're raising, Lydia.
You said the government needs to do better, but does the government have an integrity problem?
Look, I think we are a good government. I know that I and the ministers I work with go to work every day determined to serve Queenslanders, but leadership means constantly asking yourself, can we do better? You know, we've been in government 7 years now, and we can always do better, and we always want to do better. And that's the kind of leadership that I think our Premier provides. I think it's in contrast to some of the leadership people see elsewhere. But I look forward to seeing this review. I look forward to being able to implement it, because I know that we do serve the people of Queensland as best we can, and in order to do that, we need to be constantly looking at ways to do better.
Are you surprised by any of the findings in the report?
There's no findings in the report.
Well, so far he's made some findings.
He's outlined instances of issues that have been raised with him. I think he intends to make findings
Were
down
you
the track.
surprised by those?
Look, some of it spoke to experiences that weren't my experiences, but government is a big organisation, and so having seen the instances that have come up in the interviews that he's had so far, clearly there are ways we can improve, and I want to see those findings and those recommendations, and we'll take them on board.
You've said that you want the government always wants to do better, but given that this review doesn't even have the powers to compel witnesses to give evidence, why not go for a royal commission or a commission of inquiry?
Well, I think you've already seen that this review will be very useful. It certainly isn't a whitewash, as it was described by as some. It is, I think, already getting into some issues that will provide really useful recommendations to the government. And let's just let it run its course. Let's see this final report. And I think when people do, they will see that it provides us with useful advice about how we can do even better for Queenslanders.
The opposition says it fears that without people being named, say DGs or ministers, then there won't be consequences for those people. Do you think people should be named?
I think that would discourage people from coming forward. I think it would discourage them from providing the kind of frank and fearless advice that is at the very heart of the kinds of issues that we are discussing. I think I think that the way this inquiry has been set up will provide us with a very good platform to receive advice and to make changes about the way we go about our business so we can do a better job for
Why
Queenslanders.
would you have good when you can have better?
Sorry?
Why say
Well, that's
good
we
when
want
you
better.
can have better?
That's what we want, is
But
better.
the Royal Commission would be better
Well,
than this review
I don't
because
think a
it's
Royal
top
Commission would.
review.
Royal Commissions go to matters of criminal conduct, corrupt conduct. Nothing that has been raised here go to those matters. And so an inquiry of that kind wouldn't give us the kind of useful public policy advice that Peter Coldrake is going to
So
be
you
able
don't
to.
see anything that's been raised so far as corrupt or criminal?
No, and clearly if it was, it would be referred to the CCC, the Standing Royal Commission that we have every single day to deal with those kinds of issues. The issues here go to trends in public governance in Australia, worldwide, and indeed here in Queensland, and ways that we can, and I believe that recommendations and findings coming from these observations will allow us to do a better job of governing in Queensland.
Thank you.
Thank you.
When is life back? Sunday?
Bottom of page 21.
Okay. Thanks.